and for each solution we need to attach the appropriate line. The solution bags usually are large bags, usually 5 liter bags. When the solution bag is new, it will be like this. It will be separated by a membrane here. We need first to open the bag to make sure that fluid can freely move from this side to this side. This side containing the line. We need to squeeze or press, then the solution is ready. Then we open the scale that we want to apply the solution. For example, here we open this scale, which is for pre-blood pump, and we attach the scale. You attach the scale as mentioned. I can attach them like this. You can hang this to that door the way you خلاص. Now the solution is attached. We just put it like this. This one we pour, take it to the mid. Solution is in place. Then you close the scale, and then immediately you connect the line. Which one is this? This is the white one. We need the white line. This is the white line. So we open the white line. We can connect the solution directly through this one in this place, or we can take this out and place this to this area, and this is prepared because if you take it out, no leak will come. But if you use the other one and it slips or get out or taken out from this, fluid will be leaking here. So we connect. To connect there is a rubber. First we press. Then we it's ready. We finished immediately this white line. We can connect, or we have to connect this white line in this place. Only to make it straight, to prevent overcrowding of lines. The same thing we did here, we will do with the remaining lines. So if you can attach the remaining line, there is one open there. Okay. Last. Can you attach this one? Anyone?
Volunteer.
Representative Dr. Atimina.
Open the scale. Take out this one.
Pangawak mo na lang sa iba.
Dalawa yung video ko.
Ako ay nagugot na ako naligaan.
Another one can place the third one.
Oh my God. Ako na nga, Doktor.
You are the one of the sponsor. So you should be.
Yung mga tao. We are video group.
No, I'm not here. I'm recording only. I'm the cameraman. I'm not here.
Resurrected.
Basta si Bebe.
This. Close. Close. No, then just press it. Connect the line. Which line? Green line, not this one. Not this one. Open this one.
Hindi ko makikita, guys.
Left side.
Binayang ko. Ate B, left side. Uy, nakapalaan.
Door open.
Time ba?
Yes, exactly. تمام.
تمام.
خلاص we finished. We put all three solutions. Now we want to add the priming solution. We want to add the normal saline. Again, we take 1 ml of heparin. This one 1 ml of heparin. We dilute to 4 ml. We put 1 ml in each bottle.
1 ml.
1 ml, yes. We connect the normal saline to the Y line. This Y line. Now we connect normal saline to this
Doctor,
one.
this 1 ml is like 5,000 internationally.
Yes, 5,000.
1
Total.
ml in 5 ml. 1 ml in 5, then 111.
1 ml, we add to 1 ml 3 ml normal saline. So total 4 ml. We have 4 bottles. 1 ml in each.
But I think this 2 bottles enough, sir.
Yes,
for
this
priming.
this only use 2 bottles. This filter, this one M100, use 1 liter, use 2 bottles. Other filters like plasmapheresis filter, SD filter uses 2 liters. But this one M100, this one uses 1 liter of fluid. But during the therapy, we need saline with heparin. We need wash to do. Later we want to bring the blood back to the patient. But this filter will use 2 bottles of saline. We use 1 liter.
Because before the first training, the first bottle only with heparin 5,000, then the next 500 is plain. So now we will follow this 1 to 3.
We prepare all saline or priming to be heparinized. If we are using 2 bottles, this 5,000, we put in 2 bottles. 0.5 ml and 0.5 ml in the second bottle. تمام. طيب. Last things.
So, excuse me, the 5,000?
5,000 for this filter. 5,000 in 1 liter.
5,000 heparin.
5,000 heparin in 1 liter normal saline. If you have the 1 liter bag, you can put the 5,000 in the 1 liter bag and hang the 1 liter bag.
So
How about for priming all the ways?
Huh?
The connector for the
0.5.
طيب. Now we connect the 3 solutions. We connect the priming solution. Last things, we need to connect the return line to the effluent bag. This line, which is the return line. Later at the end, this line will be connected to the patient. But now, because we want to do priming, we want to the fluid going out to the bag. So finally, we connect this. We connect this to the wetting bag. Remember that the Y line, which is hung in the priming solution, containing the excess, which is the red, and containing the effluent, which is the yellow. And the effluent bag connected with the blue one, connected with the return line. Remember this, because final step when we connect the patient, all these 3 need to be changed or corrected. Unless we are ready. Again, if you can't remember and if you want to go by steps, first the machine tells you to put these lines, in their places, yellow and white here, green and purple in the other side. Second, the machine asks us to put priming solution and connect the Y line to the priming solution. Third, the machine asks to put the pre-blood pump solution and connect its line, then the dialysate solution and its line, then the replacement solution and its line, and then it asks to connect the return line to the effluent bag. It's finished now. The second step finished. We will go to the next step, which is the application of the syringe, the heparin syringe for the continuous anticoagulations. So when we press continue, next step is putting the syringe. So this is the syringe. We can يعني suppose it's 500. We can 50 ml, we can add 50 ml to it. This syringe could contain 5,000 international units of heparin. 1 ml of heparin with 249 ml of saline. It's total 50 ml containing 5,000 of heparin. Now we need to apply this line. First we take this line. This is this line for the syringe. First we open only this wide. We connect the syringe. Now syringe is connected to the line. Second, we need to apply the syringe, but we can't because this is up. So first we ask the machine to take this down, then we apply the syringe, then we ask the machine again to bring this up. So we press auto down, this will go down. Once it goes down, we apply the syringe. The syringe wings will go in this space. Syringe wings, this space for the syringe wings like this. We apply the syringe. The syringe is now on. Again, we ask the machine to bring this up. So there is auto up. We need to make sure in this it's called plunger. In this plunger could be closed and could be open. We need to make sure it's open. Then we ask the machine to go up. It will go up until it touches the syringe and will stop. After it stops, we need to close this plunger. This plunger is closed. Our syringe is in place. We press continue. It will make more seat to syringe and it will continue to the next step. Again, we will do it again. The steps to connect the syringe as follows. First, we bring the syringe, prepare and bring the syringe. Second, immediately we connect the line, because if we did not connect the line and apply the syringe, this one will press and will make the fluid going out of the syringe. So first thing, to connect the line. Then we take this down by pressing auto down. And we make sure this plunger is open. Once it go down, we apply the syringe by putting the syringe rings in its place and pressing until the syringe is in. Then we press auto up. Once it stops, we close this plunger so the syringe is in place. And then we press continue. It will make seal and it will go to the next step. The machine is forming syringe is in place now. Next step is the priming process. In the priming process, the machine will take solution. From the priming solution. Solution will go in the system, will go in the filter, and will come back out to the bag. For this filter, we will use 1 liter of normal saline mixed with heparin. And after finishing the prime, the machine need to do a test called a prime test. What is a prime test? Prime test machine will check all pressure pods will check the blood leak detector, will check the air detector, will check everything is okay, and then you are allowed to go for the therapy or for the settings. And also we press prime. طيب. Look at this alarm. It say effluent line not in blood leak detector. This is blood leak detector. تمام. So this line is not well attached to the blood leak detector. And if we see, you can see the line is outside the تمام. If you can يعني recognize the line is part of the line is out. We need this line to be inside the blood leak detector. تمام. Now the line is in place. تمام. Retest. خلاص we will start priming. تمام. Again, if the line is not in place, again we'll keep the same alert. So you need to make sure all the whole line is inside. No part of the line is outside the blood leak detector. So we press prime. This time it will go for prime because the line is adequately in place. طيب for M100 for M100 filter, priming will use 1 liter of normal saline. Priming process will take around 4 minutes. It will take 4 minutes to do the prime. We can do prime and after finish we can do reprime again if we want to make sure that there is no remaining air in the system. When the prime starts, it will start slowly. The machine will slowly start taking the fluid from the bottle. After a while, suddenly it will go rapid.
Sorry. It seems multiple air bubbles in
Yes.
the chamber.
Yes.
This is normal during priming.
Yes. We are doing priming mainly to take out this air bubble. And during priming, if the machine detected air, it will not stop. During priming, the machine know that now we are priming, we are taking out the bubbles. Because this filter is containing of large surface of tissues braided inside, containing large amount of air. So it needs fluid to go many times so the air is out. And during the process, if we start pushing the filter, we can recognize that with every hit we do to the filter, bubbles will come out. And this you can realize this in the hemodialysis center. In the hemodialysis, technicians keep doing like this to the filter to take the fluid out. Once the flow is high, I will show when you hit the filter, with every hit that bubbles come out. Also, you need to be cautious. You need not to go and let the machine do priming, because if this bottle is empty, the machine will squeeze air. If the machine squeezed air, you need to do repriming from the start. If you go for 3 seconds, 3 minutes and 50 seconds and air go in, you need to do it again from the start. And now you can you think it will take time to finish this bottle, but now suddenly it will go rapidly. Once it will go rapidly, the line will go rapidly here. Now it's going rapidly. Now you can realize that the line is going it's decreasing rapidly. Tamam. If you hit with any hit, you can realize this air bubble is coming out. Tamam. Technicians use this process to make it's Okay, but it adds nothing. يعني. If you did or if you do not, at the end priming will take out the air. No, no, it will not. But it has no benefit. يعني we don't need to do it.
Now we're seeing doctor they're doing that.
Yes. تمام. It's just for self-satisfaction. When you do like this and see air bubbles coming out, you feel good. But for the machine, it will take out all the. It will take out all the air.
So no need to tap it.
Before it's finished, we need to press stop. تمام. Before it takes air. تمام. Button is finished. We press stop. Once we press stop, we need to clamp the Y line. تمام. We need to clamp this Y line. Both of them, the two of them, need to be clamped. Once they are clamped, تمام, then we can remove. You don't need to beat the filter. And you don't need to do like this. You don't.
So guys, no need to tap.
طيب. تمام. We add the second
No, I
solution.
will not do that.
We add the second solution. تمام. Once we add the second solution, first we open the lines. تمام. Unclamp the lines. تمام. Then we press start. Spinning, priming complete in 1 minute, 1 minute remaining. يعني started with 4 minutes. Remember this priming solution, تمام, do not puncture with needles or for the priming solution. Yes. خلاص, it's almost finished. It's almost finished. After it's finished, after the priming finished, we press prime test. Prime test, the machine will test all lines, will test all sensors, pressure pots. Tamam. Priming finished. We can do manual prime if we want to take out more saline, or if we want to do more priming. We just press and hold this button, manual prime. It will prime. If we let, it will stop. If we want, we can do reprime if we want to repeat the whole process using another 1 liter. If we finish, tamam, we press prime test to make sure everything is okay. The prime test also يعني take يعني شوية long time, may take some few minutes يعني. طيب after prime test finished, we go for the next step, which is setting or putting the settings for the machine. You see this air chamber. Tamam. This air chamber should contain fluid up to this level. Tamam. Just below this line. If the fluid is too much above the line, then it's not okay. If the fluid is too low, the level, also then it's not good. We need to make sure that the level is in this place, because this level of fluid is the best level يعني to take air bubbles out. If the level is too much, air bubbles will go with the blood down. If the level is too low level may result in air also escaping down the blood. So we need to check this level after the prime test finished. The machine will ask you to check the air chamber level. It's okay. Even after finishing the priming, some air may still be in the filter. And when starting the therapy, some of air will go out. And when this air go out, once it came to the air chamber will take it out. So the level of the fluid during the therapy may go down. So you need every time to check that the level is adequate. If the level go down, you need to increase it. For the machine, there is something called fluid loss or gain limit. And the fluid is the machine is taking blood from the patient and bringing blood back to the patient. For example, if the machine take 100 ml per minute, it should return to the patient 100 ml, unless we need body fluid removal or ultrafiltration. The setting we put, the machine will try to stick to it. If the machine is recognizing that there is the returning blood to the patient is too way more than the blood is taken, or too low than the blood is taken, then the machine will stop because it feel there is something abnormal. This limit is usually 400 ml every 3 hours. The machine measures the blood that taken from the patient and the blood that returned to the patient. The difference should not be more than 400 ml. 400 excess or 400 loss, gain or loss. If the difference go beyond 400, then the machine will give alarm and will stop. It's not calculating the body fluid removal. It's not calculating the ultrafiltration. If you ask the machine to take out 200 ml every hour, it will not count this volume. For the priming, the third step from the right, the longest step. Once it's finished, the test is finished. Now the test is finished. Now the machine is asking you to make sure that the fluid level is adequate. If it's low, you need to take it up. If it's above the line, you need to take it down. How to do that? Just by pressing up and down these buttons. Now we can realize that the fluid level is here. If we press up, the fluid level will go up, if you can see. If we press the down, the fluid level will go down, if you can see, if you can recognize. It's now down at this level. We want it at this level, just below the belly line. So we press up,